asthma affects 1 in 12 children ages 0 to 17 here in the United States, and among those living in the cities. So, Doctor, we just mentioned living in the cities, there's smog, there's pollution to think about, but what are some of the other factors that could make a child or a teen at risk for developing asthma?
Sure, so things like air pollutants certainly are, like you mentioned, could be a factor. Genetic predisposition, like we mentioned earlier in the show, so things like family history. And then allergic tendencies. We'll sometimes see links between like allergic rhinitis, eczema, and asthma. So those people are more prone to develop asthma because it's a manifestation of kind of allergic tendencies. So.
Okay, so there's a whole variety of factors that can definitely trigger it. And there's also a lot of there's symptoms involved, of course, with having asthma. And so we want to mention what some of those might be. We have the coughing, especially at nighttime perhaps, wheezing, shortness of breath, chest tightness, pain, or pressure. So doctor, again, is this really kind of the most common symptoms that maybe it's time to talk to your doctor about your child or teen symptoms about asthma?
Absolutely. Those are pretty much the cardinal signs and symptoms you look for in asthma. So that was very accurate.
Okay, so good to know, dead on there. Now, the other thing, again, doctor, we've talked about the prevalence about asthma, and I guess my question is, though, how do you diagnose that asthma is what someone is dealing with, and what do you kind of rule out before you even make that diagnosis? Sure,
so that's a great point. Not one-time wheezing makes you an asthmatic, so that's a very important point.
Okay.
But when we see a repetitive pattern to different stimuli, it could be something in the environment, it could be catching a cold, it could be weather changes, it could be exercise. So when you see a repetitive pattern of these recurrent symptoms that we just saw, the chest pressure, the tightness, the cough, the wheezing, when you see a repetitive pattern and then you actually are able to document the parents telling you, I hear that kind of musical high-pitched sound, that wheeze, or I hear like that cat meowing, or the doctor actually listens to it. That really sets you up to really suspect asthma, especially when it's on a recurrent pattern and recurrent kind of intermittent, but recurrent kind of episodes happen.